everybody. Welcome to Health with Priscilla with your new hostess, Camilla. Due to unfortunate events, Priscilla will not be here, so I'll be standing in for her today with Dr. Mhata as our guest today, speaking about the new virus that has broken out, COVID-19. Dr. Mhata, would you please like to introduce yourself to our guest?
Thank you very much for having me. My name is Pertus Mhata. I'm working for WHO. I'm an emergency focal person supporting the Ministry of Health and the government in response to COVID-19.
So today we'll be asking a few questions about the new virus COVID-19. And the first question is coronavirus airborne?
Well, before I answer whether or not coronavirus is airborne, let me raise the point again that this coronavirus is spreading fast. Now, as of yesterday, 2nd of April, it's close to 1 million worldwide, with about 48 deaths. In Africa, so it's close to 5,000 now, with 127 deaths. So, but in Africa, we still expect it to go faster. So, but we need really to prepare ourselves well to make sure that we are well armed and equipped to protect ourselves and our families against coronavirus. As to whether it is airborne, no, we don't have evidence yet to suggest that coronavirus is airborne, because when somebody coughs, the way it spreads, the droplets are heavy and then they cannot go far and get suspended in the air. So it is not airborne. But of course, during some medical procedures, this is where the healthcare workers are expected to put on precautions, because it can be suspended in the air in a shorter distance, not longer distance. Yeah.
Thank you so much for that answer. So this has been recently misconcepted. A lot of people think if they step in the same room with somebody with coronavirus, they'll immediately get coronavirus. So thank you for clarifying that first question. The second question is, what are the most effective ways that we can protect ourselves from the virus?
The effective way to prevent or to protect oneself from coronavirus is to regularly wash one's hands with soap and water. And also, if you don't have access now to water and soap, the best way also is to use the alcohol-based hand rub. Preferably the 70% alcohol-based hand rub, because that one has been proven, to be effective in killing the coronavirus. Also, when one is coughing or sneezing, the best is to always fold, your elbow, so that when you are coughing, you don't spread, anything that is coming out of the lungs and nose and mouth. Also, when you are close to people who are sick, probably with corona or COVID-like symptoms, coughing, sneezing, keep a distance, because you never know. Maybe it's corona. So we should take care of ourselves to make sure that we keep a distance to prevent, getting infected.
So the next question we have is, what signs and symptoms differentiate from a common flu and cold to COVID-19?
I think for the purpose of the information sharing, there's no clear-cut differences, in terms of the symptoms of coronavirus, symptoms of flu or common cold. They are all related to fever, cough, and also difficult breathing. But the difficult breathing is more common and pronounced with the coronavirus.
So the next question we have for you is, during the incubation period, the time between when you contract the coronavirus and when your symptoms start, can you still infect others with the virus?
That is very rare. There are reports that you can spread the infection when you don't have symptoms. That is now during the incubation period, but that is rare. So what we know is that the symptoms, when you are symptomatic, having symptoms is when you are really spreading the infection.
The next question we have for you is, would you recommend that people wear gloves, mask, and buy food in bulk as a precaution?
Not necessarily, particularly now with the buying of food in bulk. Government has made it clear that the supermarkets will remain open, so there's no need to panic and buy in bulk. So now, with regard to wearing masks are generally recommended to be worn by somebody who is having infection, and in order to protect others from this infection from him or her. So it's also recommended for people who are taking care of sick people with coronavirus. With regard to the gloves, again, it's recommended only for people taking care of sick people. With regard to buying in bulk, it's not necessary because supermarkets are open. We can buy every day.
And the gloves?
The gloves, as I said, are also just for people who are taking care of sick people.
Okay. Thank you very much for that answer. I know it was very much needed by some of you. The last question would be, in conclusion, do you have any final words or advice for the nation?
The final word and advice to the nation really is just to say that we should all take responsibility. It's not only responsibility of government, but everybody has responsibility. Hand washing, respiratory etiquette. If you feel sick, please go to, and you have signs of, corona, maybe, coughing, etc., go to hospital. Or, and also stay aware of the latest information by trustworthy sources, like the government, Ministry of Health, and WHO, amongst others.
Thank you so much, Dr. Mhata. Thank you so much for joining Health with Priscilla with your new hostess, Camilla. But just for now, we want to wish Priscilla a get well soon. And yes, thank you.
Thank you very much.